Hello everybody, I'm Abasud and welcome to my course on HIPAA regulation. So our today's topic is HIPAA security rules. So let's start with what is HIPAA security rule contains. It contains the standard that must be applied in order to safeguard or protect electronically created, access, process and stored PHI data. If it is electronic data, then we say it as a ePHI data that can be at rest or in transit. So we need to protect our data, ePHI data at rest or in transit. So to whom this rule is applied? This rule is applied to anybody or any system that has access to confidential patient data. In this case, access to interpret it as having the mean necessary to read, write, modify, or communicate ePHI or any personal identifier that could reveal the identity of an individual. So now there are three parts of PHI security rule. This is basically how we can safeguard our uh, HIPAA data, PHI data. So first is technical safeguard, second is physical safeguard, third is administrative safeguard. So let's discuss about them one by one. So let's start with the technical safeguard. So in the technical safeguard concerns the technology that is used to protect the ePHI and provide access to the data. Here we are talking about the technology. Let's first come into the access control. When we are talking about the access control, we are saying we should be having a technology where we should be having a technology to provide the access to our system which is having the ePHI data. We should be having the process in place, so with the proper authorization, proper approval, the access should be given. We should be having the differentiation of privilege access and segregation of duties, and we should be well defined in which cases the data can be disclosed. This is our access control. Second, talks about our authentication mechanism. So it should be compliant with our HIPAA regulation. It confirms whether ePHI data has been altered or destroyed in an unauthorized manner. So this is what we are having, the authentication authentication part of the technical safeguard. Third is encryption, where we are putting the safeguard of data at rest or data in transit. So in whatever the case is, if there is an attack happens, somebody is able to view the data. Because of the encryption, they will not able to interpret it, or we can go for the data masking as well. So whosoever are the internal users who need to see the data, they need not to see the complete information, so only the half information is available to that would not be much useful for that. So we can do that. Then the next is the audit log. Audit log should be available for any creation, change, modification of the PHI data, so that we know who created it, when it got updated, why it got updated, and who did the changes. So complete detail we'll be having. Next is the session expiry. So even if the user forgot to log out, session will automatically expire. No attacker can leverage the active session and do a false activity. So this is what we are having, the technical safeguard, where where we are talking about the technology who can protect the ePHI. The next we are talking about the physical safeguard. Safeguard focus on physical access to the ePHI data irrespective of their location. So here we are talking about physical safeguard. Let's suppose if it is a cloud, we are taking the cloud infrastructure. So where so we need to protect it. That can be through access control, that can be through our contract with the cloud service provider, that can be through looking at their SOC 2 reports. So all those things, if it is in premise, so we need to take care of that, like a proper access control would be there. Maybe you're having the card punching to access the the place or biometric or facial recognition to enter into the server room where the servers or systems are located. Next is policy and use of positioning of devices. Then we should be having the policies like in which place our system should be located so that we'll make sure they are protected. Like we can say our system should have a multiple factor authentication. So, it should be in a locked room. That room must be having a fire extinguisher. That room should be having air condition and all those things which are required. Every time network is available, backup should be there. So all those things should be here. In policies and procedure of mobile devices, basically here we are talking about the bring your own device. Like generally the health worker use their own own device to perform the work as well. So what is the policies for that? If they are storing the data on that particular device, it should be encryption should be on. There should be a facility like if it lost, so on a remote basis we can erase the data from that device. We and the last is the hardware inventory. We should have an inventory of all the systems, be it a router devices that can be firewall switches, router, our wireless controllers to our end users, laptop, mobile phones, if they are having data cards, or if we are providing them RSA tokens, and for everything the inventory should be there. So we'll be aware on which places data has been stored, or from which place to which place data is getting flowed. So we can put a proper security control. Our next safeguard is a administrative safeguard. Administrative safeguard are the policies and procedure which brings privacy rules and security rules together. So here mostly we are talking about policies. We should be having a risk management policy, which talks about what is the what is the tolerance of risk, what are the different levels of risk, and how we are calculating our risk. We are reporting the risk on a periodic basis. Then we should be doing the risk assessment on a quarterly basis. We should do a risk assessment, and how should we do that? A proper documentation should be available. We should train our employees so that they can safeguard themselves from the attack, like the phishing email, how to identify the phishing email. Then we need not to share the password. The password should be strong enough. So like this we can train our employees. Then contingency plan. So if this is basically the business continuity plan. If what is the DR side, what is the secondary side? If one side is down, who can take the load so that a service will not happen? So this is a contingency plan. So third is the third party access. How we are managing our third party access. Let's suppose if we have hired somebody to take care of our data, that is healthcare cleaning house. So how their access should be managed. They should be following our policies. They should go with for the audit on a yearly basis, and we should be having their SOC 2 reports, or we should be having the authorization to review their controls. The next is security incident. If incident happens, how they are responding to them, how they are detecting it, how they are trying to protect from it. If it happens, how to detect it, how to respond to the incident, how to recover till the earlier stage. So all those things should be defined. So this is what we are having for the security rule. Thanks for joining.